Good afternoon, Dr. Gary here on the road. We sell dental practices nationwide. Name of our company is Healthcare Practice Sales LLC, also known as Nationwide Dental Practice Brokers.com. So today's topic is as we reflect back of successful dental deals, how things worked out well, and how the doctor, buyer, and seller were able to go to closing, even through challenges. So the name of this topic is Anatomy of a Successful Sale of a Dental Office. What does it take? So we'll go over that. As you know, we've been doing this for 13 years now. I was a dentist for 25. We're in 28 states. We have 10 employees, and we're at your service. We work every day except Christmas and Easter, and we are here to serve you. Please call us. We can give you advice at any time, buyer or seller. There's no charge for advice. Also, our number is 201-663-0935, and our website is dentalpracticeguide.com, and also nationwidedentalpracticebrokers.com. So we're here for you at 8 a.m. in the morning till 9 p.m. East Coast time, every day except Christmas and Easter. So please give us a call. Now, the information you're about to hear is for entertainment purposes only. It's not legal advice. If you're thinking about selling to a dental DSO and you're over 1.3 million and have like at least 5 chairs, please give us a call. We work with them frequently. We are independent. We pick and choose who we think the best ones for you are. But often they will pay our commission. So there's no commission to the doctor, seller, and they will often, if you work together with us, many times we can get your legal fees reimbursed upon successful closing. And we've done that a number of times, so call us about that. So what does it take to have a successful closing, to go to closing, to get the practice finally sold? Well, you know, I look back at some of our more challenging deals, but we still had success. I'll tell you what it takes. It takes a willing buyer or a willing seller that's able to accommodate us. If either the buyer or the seller are difficult to work with, we can still get the job done. Need a landlord that is compliant, and many of our deals, unfortunately, they're not compliant, but we were still successful. But the key is a dental attorney, as I've mentioned multiple times in the past, for the seller, dental attorney for the buyer, and one of the great dental banks that has tremendous experience. Been in the field a long time. It doesn't have to be the largest bank. It is the bank with the most experience in doing dental deals. And dental deals, you have to know what you're doing. On the East Coast, there's about 4 or 5 of those banks. But there just aren't that many nationwide. These are all nationwide banks. So you've got to have the right bank, the right attorneys, because they know how to put it together. So recently, in the past, we've had a difficult time that we had a landlord that was very difficult. But we had a buyer that was focused, a landlord that was unfair and it just kept beating us up. But we had a buyer that was focused and wanted to get the deal done. We had a seller that was focused. So again, I say to you, even though we had one component of the final sale, one component going to it, because we have 10 moving parts: buyer, seller, buyer's attorney, seller's attorney, buyer's accountant, seller's accountant, bank attorney, landlord attorney. It's 10 parts. But you can have one of the parts that's broken, it's not working, and still be successful. What it takes is you have the majority of the moving parts that are working together. You'll just get it together. And they know how to do it, especially dental attorneys that have worked together in the past. That is the key. So we had a very difficult, a nightmare landlord, but we were able to get through it by negotiating and talking, and then some compromises on the seller's part, compromises on the buyer's part. We had 2 willing parties. on that deal didn't necessarily say that the landlord was, the seller was super easy to work with. They were a little bit challenging, but we still had great dental attorneys. You had a great dental bank. We had a great dental buyer. So because of all that, it it worked quite well, and we were able to put a deal together. And I look at these deals. So again, if you have a few broken parts, a few parts that aren't functioning well, if you have stronger other moving parts, such as great buyer, great seller, great bank, great attorneys, you could still do it. And that was the anatomy. So starting out with the foundation to get these deals done, it's great dental attorney, great dental buyer, great dental buyer for the great dental attorney for the buyer, great dental attorney for the seller, great dental bank. Those are some of the components, willing parties, and that's how we get through all these times. So it's never easy, but we got through. Stay tuned. We have all new deals coming through soon. We're visiting soon. I got to get back down to Georgia. We got some deals down there. I have to make it out to Nevada. So listen, and we'll be get our new list of practices to sale. Thank you for listening. Bye now.